So thank you very much. And it's my pleasure to introduce the Honourable Emma McBride MP, the Assistant Minister for Mental Health and Suicide and Assistant Minister for Rural and Regional Health. And it's great to have Emma with us. I'm going to read a short bio. Emma McBride is a federal member for Dobell on the New South Wales Central Coast. Since 2022, she's been the Assistant Minister for Rural and Regional Health and the Assistant Minister for Mental Health and Suicide Prevention in the Albanese government. Emma is a registered pharmacist who has worked in the health sector for over 20 years, both in Australia and abroad. She was a specialist mental health pharmacist and the chief pharmacist at Wyong Hospital for nearly 10 years, and prior to entering Parliament, she was the Deputy Director of Pharmacy for the Central Coast Local Health District. Emma's background and experience as a healthcare professional led her to Parliament, where she fights for better health services for all Australians. She's a passionate advocate for quality, affordable healthcare close to home. She understands the unique challenges facing rural and regional communities when it comes to accessing healthcare, and she hopes to play a role in shaping public policy that promotes the health and well-being of every Australian, regardless of where they live. So I think you'd join me with knowing that Emma has got the perfect background for someone to speak to equally well and knows what we're facing. So thank you very much, Emma. I'd like to welcome you to the stage. So thank you.
Thank you, John, for that very generous introduction. Thank you and good morning. And I know Annie Joan has left, but also I would like to reflect on her very generous welcome to country to all of us today. Before I begin, I also want to acknowledge the traditional custodians of the land on which we meet and to pay my respects to elders past, present and emerging. And I extend that respect to other First Nations people who are here with us today. And in doing so, I recognise the stark disparity in physical and mental health experienced by First Nations Australians. And I'm proud to be part of a government that will give every Australian the opportunity to vote for constitutional recognition through a voice at the referendum later this year. Until First Nations people have a say in the policies and programs that impact them, we won't close the gap. And when it comes to the voice for me, as with my responsibilities for mental health and suicide prevention, what is front of mind is the rate of suicide for First Nations Australians. What we have done, despite our best intentions, hasn't worked. First Nations people die by suicide at more than twice the rate of non-Indigenous people. And when we talk about closing the gap, this is what we mean. The difference between Indigenous and non-Indigenous lives. And this is what the voice will be focused on. Listening, properly listening. Listening and genuinely listening is central to good policy development and meaningful change. But despite our best intentions from successive governments over decades, First Nations Australians haven't been properly heard. So I encourage everyone in this room to think very deeply about their contribution to the upcoming referendum. I would also like to acknowledge the individual and collective contributions of people with lived and living experience of mental ill health and suicide, as well as those who are carers or supporters of people living with mental ill health, who are making valuable contributions to improving mental health care right around Australia. Thank you, Russell Roberts, the Director of Equally Well, along with John and Dave, co-chairs of the Equally Well Alliance, for inviting me to open the 2023 Equally Well Symposium. The next 3 days will be a welcome and exciting opportunity to showcase the important work happening across the sector to improve the physical health of people living with mental ill health, a particular personal interest of mine too. It has now been just over 12 months since we came to government, and in those 12 months I've been in many rooms just like this, where I've had the chance to hear from people with lived experience, researchers, clinicians, service providers about what needs to change and how together we might be able to work towards that change. And in the last 12 months, we have laid the groundwork for this change. That is perhaps most evident in our latest budget. We understand that the first step to making sure that all Australians can get the care that they need, and more importantly, the care that they deserve, is making sure that we have our leading healthcare workforce, and that includes peer workers and people with lived experience, in the places that people need them when they need them. It's no use attempting system change without the right people working within that system in the right places. It's why we invested in new postgraduate psychology places, new internship for provisional psychologists, and new fully subsidised supervisor training sessions. We also know that psychologists work best alongside doctors, mental health nurses, social workers, OTs, pharmacists, and peer workers in our multidisciplinary system of care and teams. Recognising when someone is in distress is critical across the healthcare sector, but more broadly across society. And we want to make sure that no one is lost to our system of care or falls through the cracks. It's why we're investing in building the knowledge and skills of the broader health workforce so that they are better equipped to recognise and respond to people living with mental ill health wherever and whenever they present. This includes nurses, paramedics, emergency doctors, and allied health professionals. But what I want to speak to you about today is not what we've done so far in the past 12 months, but where we're going from here. We do have an ambitious agenda that is underpinned by our values and our belief. And today I want to touch on 3 of those. We believe firmly that we must improve equity and access, that we must reduce the drivers of distress, and that we have to elevate the voice of those with lived and living experience. And when we talk about equity and access, we mean just that, getting more Australians who require mental health care into the system, especially for those who need it the most. The fact is, as you well know, that our system was not working well when we came to government. It was harder and more expensive than ever to get in to see a GP or a psychologist. Many of you would be aware of the Better Access Initiative, the Commonwealth scheme to help people access mental health professionals and care. The evaluation, which you'd be familiar with, led by Professor Jane Purkis, found that the Better Access Initiative was becoming increasingly difficult to enter. However, we are turning this around. In the first quarter of this year, we saw a significant 14% increase in the number of services offered through Better Access. But more importantly, we saw more people getting the care that they need. More than 60,000 more people were able to get into the system from the 1st of January this year. We will continue this work with the sector. What we're also working on is our Head to Health services across the country. Head to Health is free, walk in, no diagnosis, no referral needed. That is equity and access in practice. There are currently 12 up and running around the country, and we plan to set up a total of 61 right around Australia. And I have had the privilege of visiting services in Geelong, Townsville, Launceston and Penrith. And just a fortnight ago, I had the pleasure of opening a new service just down the road from here in Parramatta. The service had been running as a pop-up since 2021 in response to the COVID-19 pandemic. In that time, it had helped more than 500 people who may not otherwise have been able to access care when they needed it, close to home and affordably. Now it has a permanent home. It will mean that more people can get the care they need when they need it. But we know that care is only one part of the picture. If we can support Australians before they require care, then we should. Our government is approaching mental health and suicide prevention as 2 separate but related issues, because we know that while mental ill health can be a factor in suicide, people who die by suicide typically have on average 3 to 4 contributing factors. These factors include unemployment, financial insecurity, domestic and family violence, and past or compounded trauma. We also know that around 40% of people who die by suicide have no diagnosed presence of mental or behavioural disorders. Numerous reports, many of them drawing on those who have attempted suicide or who have lost loved ones to it, have highlighted the very critical need to expand our suicide prevention efforts in order to address the underlying causes of distress, the causes of the cause. What this means is that we aren't only responding through mental health support, but working to alleviate the underlying pressures in people's lives which cause distress. It's a subtle but important distinction in the approach of the Commonwealth Government. This will improve the quality of life of hundreds of thousands of Australians, reduce the need for emergency healthcare, and most importantly, save lives and improve the quality of lives. Just last week, the Treasurer, Jim Chalmers, released the Measuring What Matters statement, the Australian Government's first national framework on wellbeing. What that framework makes plain is that traditional economic indicators, of course, provide important insights, but not the complete picture of well-being for individuals, for communities, for our country. As the Treasurer has outlined, we are eager to identify challenges earlier and intervene in a more targeted way to create opportunity for all Australians. What is front of mind for our government is that our policy decisions have a real impact on Australians. And for that matter, so does poor policy or poorly implemented policy. Take the robo-debt scheme. It showed us that public administration can fail, and when it does, can result in real human tragedy. And my condolences to the individuals and families and communities that have been impacted by the scheme. It shows us the impact of political expedience and indifference for those in need, especially the most vulnerable Australians. And we are committed to make sure that this doesn't happen again. Measuring what matters and our commitment to alleviate the drivers of distress is central to doing this. And while we work towards this change, we need to include the voices of those who have been left without a seat at the table for far too long. We are determined to put the voices of people with lived and living experience of suicide and those impacted by mental ill health at the centre of decision-making to inform policy development. In January this year, we announced that we would set up 2 peak bodies for those with lived experience. One for those with lived experience of mental ill health, and the other for their carers, family and kin. 2 distinct but equally important groups which will provide valuable insight. And I'm pleased to report that the progress in setting up these peaks is tracking well. Recently, we appointed the Australian Centre for Social Innovation to work with the mental health sector and people with lived experience to design these peaks in a genuine co-design process. This process will run from July till October this year. And as you are well aware, mental health and suicide prevention in Australia is complex, difficult to navigate and made up of a wide range of stakeholders, some small, some large, some with quiet voices, some who are quite loud. These stakeholders span the range from small community fundraising efforts through to multinational service providers. And while these individuals and collectives do important work, we do need to formalise how government receives advice and counsel from those with lived experience to make sure that they're properly and genuinely heard. These 2 peak bodies will do just that. With the current progress, we expect that they'll be up and running by early next year. And I'm pleased to announce that this week we will open the public consultation for these peak bodies. The consultation will be open on the TACSI website. And I encourage you to actively engage in the process because we need your insights and your perspective to make sure that we get it right and to improve the mental health system of care for all Australians. The work that we have done so far and the work that we plan to do is not possible without working in strong collaboration with each and every one of you. I know that it is through this honest and robust dialogue and where we sometimes won't see eye to eye that we will find our best solutions. So thank you for your efforts, your contribution and your genuine will for meaningful change. And I trust that working together we'll be able to achieve just that. Thank you and congratulations.